GI pathologies and abdominal pathologies, they present with various symptoms. The most common symptom which cause the patient to present either to the emergency room or even to outpatient clinic, and either as emergency condition or elective, it is the abdominal pain. It's the pain, which is the most irritating symptom for the patient, which will motivate them to see medical advice. But in addition to this symptom, a long list of symptoms also may cause the patient to seek medical advice. This is a list of possible common symptoms which might lead the patient also to visit a medical clinic. Abdominal distension. Abdominal pain. مين بعطينا example شيء ممكن يعطي abdominal pain؟ Pathology. Okay. Abdominal distension. Pathology. Okay. Common to present acutely abdominal distension. Internal obstruction. It's a common presentation. Jaundice. What do you mean by jaundice? ها؟ حد بيعرف شو المقصود بالجوندس؟ Yellowish discoloration of skin and sclera. Anal pain and bleeding, also one of the common presenting symptoms. Bleeding per rectum, massive bleeding per rectum, also another presenting symptom. نسميها هيماتيكيزيا here. ميلينا، ايش مقصود ميلينا؟ Okay, black tarry stool, yeah, signifies small, prolonged, recurrent bleeding. So RBCs are mixed with the stool, the structural heme, it will become black in color. While if it is a fresh blood, large amounts, it's called hematochezia. Change in appetite, change in weight, also a common presenting symptom. Lumps, also swellings, another symptom which is frequent to be seen. مين بعطينا example على lumps بالابدومن مثلا؟ abdominal wall. يعني هو راح اكيد المريض مش راح يشوف any lumps or masses inside the abdomen. بيشوف الخارجي. شو most common lump or swelling which might lead the patient to see medical advice? وين بالابدومن وول؟ طيب اوكي، يعني with time هذا راح يصير more professional answer. You will start to tell us that lymph nodes usually from the abdominal wall are draining to certain areas from the above the umbilicus. They go to the axilla. They don't have a lymph nodes within the abdominal wall, while infraumbilicus they go to inguinal region and so on. يعني راح تعرف انه ما في يعني lymph nodes في المنطقة. They will drain to certain areas. So common problem. Hernias is the most common answer. Okay, so the idea فيها انه في a various or a long list of possible symptoms for a patient either with GI problem or abdominal problem or pathology which will lead this patient to seek medical advice. The commonest abdominal pain. The abdominal pain most triggering symptom. إذا في حد له سؤال بأي وقت تقدر. Now to shift for the examination. Examination, في general examination وفي abdominal examination. General examination related to GI tract specifically and abdominal examination. You need to learn these skills for two reasons actually. one of the reasons is to pass your exams. You should know the skills, you should have the knowledge and steps. We should do it in a professional manner. The other thing, you need to know these steps even if they are normal, so later on you will start to appreciate what's abnormal. اوكي. انتوا اخذتوا الجنرال اكزامينيشن المفروض تكونوا بداتوا بالانترودكتوري صح ولا لا؟ الجنرال اكزامينيشن انا probably it's better to show you a video and we will comment on this. هذا فيه له صوت ولا لا؟ مش حد له خبرة بال بتطلع في سماعات بقصد
في سماعات جرب هذا بروح اجرب
الأوبجيكتيف من الجنرال examination you should be professional always, know how to approach your patient. This is the here where respect between you and patient will start. The targets تبع general examination is to have a general look and then gross or evident abnormalities seen in the patient, and to check for general GI manifestations.
صوت من اللابتوب.
في صوت؟
من اللابتوب كيف
اسمح لي اجرب
First step, دائما you have steps to prepare before starting with the patient, which both will show your respect to the patient, and if you are in examination or the exam, it will show your professionalism, like preparing yourself, good lighting, environment is suitable, washing your hands, warm hands, and so on. Next step, then introduce yourself. Ask permission. Explain for the patient what you are going to do. Patients in general, all over the world, they don't like to be attacked by examination, like starting pushing them or checking this area or pulling their clothes and starting to look. You should always explain to the patient what you are going to do. We are going to examine, for example, this. We are going to look at you. We are going to check your eyes. We are going to touch your abdomen or tummy, and we are going to press, and so on. You will anticipate or expect what you are going to do. طيب ما في مشكلة.
أتوقع السماعات مش شغالة.
Face nice. Okay. If you could just look straight ahead for me. Hi there, my name's Andrew, I'm one of the final year medical students. Could I just check your name and date of birth, please?
Yeah, James Alexander, 13th of December 1989.
Nice to meet you, James. Today I've been asked to examine your abdomen. This will involve looking from the end of the bed, feeling various areas of the abdomen, and then listening at the end. Would that be okay?
Sounds fine.
Brilliant. Have you any pain anywhere at all?
No,
And have you got any questions about the exam?
no, not that I can think of.
Okay. Okay, James, we can start the exam now.
Now, the steps of general examination for GI tract. Usually, you should have a system for your examination. Most frequent start peripheral to central. Start from the hands and upward. Initially, general look, then from the hands to central area. Okay. Here he is going to start by the hand. So someone will start from the face downward. Probably this is possible as long as you have a structured system, you will not miss things. بالhands في related manifestation to GI tract or chronic liver disease. They are the most frequent, most common to be looked for in hand examination. They are not complex. They take few seconds just to have a look. The principle of doing the examination, especially if you are under exam, is to do a running commentary. What do you mean by running commentary? I am looking and commenting. So we'll show that you know what you are looking for. This is the right way to do it. For example, I'm looking at the patient, there is no this pathology, no this pathology. Running commentary, you are doing and commenting. The other way is to look and give a detailed summary at the end. Usually this is stressful, you will forget most of the findings and most of the steps and most of the things you look for, or you even exclude it as negative. So the best way is always to do a running commentary. I am doing and commenting. Here probably he will leave it to the end, but this is one of the ways.
I'm just going to start by having a look from the end of the bed.
So general look, usually things at like in body build, if there is evident scars, if there is evident distinction all over, or any masses.
James, I'd like to start by looking at your hands. If you could just bring them up in front of you, please.
Now, all of these are changes related to GI tract. You know,
And if you could turn them over.
their significance and their definition موجود بالبوكس and so looking at the hand. If you are doing this, you say, I'm looking at the palm, there is no palmar.
Fantastic. And if you could bring two fingernails together like this for me.
هذا ايش التست؟ finger clapping. Okay.
Brilliant.
ليش الفينجر كلابينج؟ chronic liver disease بتروح الانجل هاي اللي between.
Then you can relax. James, if you could now bring your hands out in front of you and cock your wrist back and keep it there.
Okay. Now you are doing this. You are looking for. You say, now I'm checking for flapping tremor or asterixis, which is involuntary movement when asking the patient to stretch his palm backward. Usually, this is also a manifestation of a chronic liver disease.
And relax.
Here, crucial at this stage, دائما بعد الهاند check offer to do vital signs. Vital signs, they are very crucial part of any general examination for any system, GI, respiratory, hematological, or any other system. So check the pulse and then proceed.
If you could just lift your right arm up for me. And your left arm. That's fine. James, I'm now going to have a look at your face and eyes. Okay. If you could just look straight ahead for me. I'm now going to pull down on your lower eyelid.
Hello.
And just look down for me. If you could just open your mouth for me. And lift your tongue to the roof of the mouth. That's great. James, if you could now sit forward for me. And I'd like to examine for any glands in the neck.
Now we proceeded more central. No, it's not thyroid, it's cervical lymph node. Why? Because they are part of GI examination. Pharyngeal or neck structures with GI tract, they manifest as lymphadenopathy if pathology is present. This is one thing. The other thing, many intra-abdominal pathologies like cancers, upper abdominal cancers, pancreatic cancer, even gastric cancer, they can manifest as or present as lymph node enlargement in the neck, especially the left supraclavicular region. Why? Because of the drainage of the lymphatic system. The cisterna cali, which is a lymphatic collecting system موجود بالabdomen, will gather these lymphatics through the lymphatic channel in the thorax, which will end up in left subclavian. So lymph nodes will be involved and so on. The lymph node here, it's not the thyroid examination, it's a lymph nodes. He said lymph nodes, infection or malignancies or so. Groups of lymph nodes, I'm sure انه you will راح يشرحوا لكم اياه او راح تاخذوها، راح يكون مطلوب منكم في groups of lymph nodes for examination بالنك starting بال submental, submandibular في anterior cervical lymph group upper, middle lower في posterior cervical وليتر في pre-auricular, post-auricular and so on. Like كل الجروبs you will learn how to do it.
I'd now like to more closely inspect the chest.
Also manifestation of chronic liver disease.
James, we're going to move on to more closely examine.
Okay. Oh, this is the general examination for GI tract. It takes 2 or 3 minutes. حد له أي سؤال؟ So, in general, after introduction, permission, explanation, and environment suitable and so on, we look at if the patient is in pain and اللي حكيناهم body build important, patient obese or cachectic or whatever. In hands, looking for certain findings like clapping, chylonychia or other findings. Vital signs should be checked. Mouth for certain findings like ulcerations or if there is stomatitis or candidiasis. Look in eyes, usually you look for pallor and jaundice in eyes for GI tract. Lymph nodes, chest, gynecomastia spider. Under breast gynecomastia spider ممكن يصيروا بالliver disease, chronic liver disease. Yes, less estrogen high. Yes, so destruction of this takes place with liver. It is not doing its job, so estrogen. If there is evident nutritional abnormalities, you will proceed by assessing these abnormalities like body mass index and so on. The stigmat of liver disease, to remind you again, for example, peripherally, hands, either erythema or contraction. The nails, there will be whitening, لو ليوكونيكيا يقول ليش؟ لأنه albumin ما في synthesis. Other problems, spider nevi also for disturbances, protein and hemodynamic disturbances, gynecomastia, testicular atrophy, ascites. These are the stigmata of chronic liver disease. Okay, now we start to pick abnormalities if you see them. Why you learn to do these steps? If there is something abnormal, you should know. هذا الدوبترين contractures راح يصير في زي fibrosis. Patient will not be able to unfold his hand. Jaundice will be clear. This is gynecomastia, for example. The lymph nodes, cervical lymph nodes, كلها من metastatic cancer from the intra-abdominal region. عشان هيك كانوا نفحص الليمف نود. This is the spider nevi, usually upper chest. This is the body build. We look at the body build. It might reflect either nutritional problem or malignancy, or chronic infection like TB, cachectic, and so on. Mouth also. That's why we ask the patient to open your mouth. ممكن يكون في oral thrush or candidiasis, which is a manifestation of either chronic infection or even deep malignancies. And immunity is affected. Fungal infection will flourish. Ulcerations will mouth ulceration or stomatitis, which is sometimes seen in certain either iron deficiency or what. عندنا سؤال يا أثنان؟
Stand by your side. I'm just going to more.
طيب abdominal examination في له certain preparation, position, exposure, shampoo, environment. Again, all of these should be considered before you start your examination. Right position, the right exposure also should be always done. Right position or right exposure level. راح تشوفوا various possibilities, various suggestions. Just to know what's mean should position للabdominal examination. Supine, sitting, semi-sitting. Supine. Exposure. Ideally, if it's possible, from the waist upward. What's enough from the suprapubic region up to the epigastric area, low xiphisternum, to the xiphisternum, or nipples, يعني هذه levels اللي acceptable. You don't need to ask every patient to understand. It will be very difficult. The patient will not cooperate with you. Here it is from the waist upward. إلها parts طبعا.
Closely inspect your tummy.
So بالinspection. The objective بالinspection I should go on. Before we start inspecting, it's crucial to remember how to divide the abdomen, how to look at the abdomen. ليش we divide, or externally we divide the abdomen or look at the abdomen to make the description of pathologies or abnormalities very clear, unified. نحكي مثلا لو بدك تحكي لحد انه كان عنده في الرايت upper quadrant في something, he will immediately he will imagine this. He had a left iliac fossa, this pathology, he will know it. So I can specify the abnormalities and unify the description. The methods to divide the abdomen externally في two methods, either 4 quadrants or 9 regions. 4 quadrants بناء على line من الumbilicus upward and lateral, vertical and transverse. Regions by 2 lines from the midclavicular line, midclavicular region. These are the vertical lines, and horizontal subcostal horizontal line أو some pyloric line also والinterspinous أو intertubercular line اللي between the spinous process of the iliac bone بصير لنا 9 regions وهذا الأسمائهم في أحد ما بيعرف هذا مش فاميليار معهم مثلا بيري umbilical epigastric hypogastric It will divide it to right hypochondrial, epigastric, lymphogastric, right iliac, and so on. Observe now, unified, easy to describe, easy to detect abnormalities within these regions. Why? Because abnormalities or pathology in any of these regions are related to certain known pathologies. أنا لما نحكي رايت إليك فوسابين مثلا إيش ممكن يكون أكثر شيء؟
appendicitis.
Appendix, right إليك right hypochondrium. So when we look at the abdomen, also we check if there is abnormalities like these scars, distension, pulsations, stomas, and so on. Okay, just look and comment. What would you say? For example, in a normal patient, I can see no abnormalities, no scars, no massive umbilicus centrally located. There is no stoma, there is no abdominal distension. The movement, abdominal moves with respiration. It's a running commentary. Here, mentioning these things becomes important negative. I should comment. If there is abnormality, for example, كان سكار عامل عملية بالسابق whatever, there is a scar in this area. If there is a distension, there is a distension, and so on.
I'd now like to move on to feel different areas.
Okay. As we said, this is how we divide it. Why? Because structures, organs, and their pathologies are related to these areas, regions. These are the planes. I can have two vertical, midclavicular, two horizontal. This is the subcostal and intertubercular or interspinous line. And 9 regions اللي راح يجوا. The basic skills اللي you should always consider. There is good light, warm hand. Position, right exposure. Okay. Certain maneuvers sometimes needed, like if the patient is tense or stressed, it will not be easy to examine his abdomen. Sometimes you ask him to flex his knee. But there's the right position, supine, in hands usually at the side of the patient or at the chest, like this. Well, probably most of females prefer this to hold clothes to make sure they are holding their clothes. So both are acceptable. The area exposed acceptable for abdominal examination is suprapubic region up to the scale. Now we will proceed with the inspection. Step inspection. Usual inspection, palpation, percussion, auscultation. Now, when you can do inspection, auscultation, then you proceed percussion or palpation, percussion, whatever. You want to have your own system, which is usually constant. Auscultation, some people, they recommend it before other parts. Why? Not to trigger bowel movement. بصير عندك abnormally forced high bowel movement. But still, you can do it. The inspection, you will see the appearance of the, usually average, flat, it will be flat. Scaphoid, like this abdomen, certain abnormalities, for example, advanced malignancy or patient nutritionally depleted. Patients who remain on ICU or ventilator for a long period of time, usually they lose a lot of their nutritional support to muscle mass and so on. Distension. Symmetry, also important to comment on when you are inspecting the abdomen. There is distension, but it is not generalized like certain is left side. You comment on this, regardless of the underlying cause, but you comment on this part. For example, hernia or a mass. If distension was generalized, غالبا it's related to some form of either gases like sinus obstruction, the fluid, situs, pregnancy, and so on. Yeah, many other reasons. Besides, just easy to remember. Localized, always try to exclude hernias, masses, or large organs. The skin also things to comment on umbilicus, its location and its appearance. If there is scars, there is stria, discoloration, venous patterns, hair distribution, and so on. All of these should comment on. If they are normal, comment on them as negatives. So this is for the sake of examination. And they should say there is no abdominal distension. There is no abdominal distension. There is abdomen moves with respiration, normal color skin, umbilicus centrally located, it is inverted. تحكي هذه الأشياء normal findings. هذا النورمال abnormal مثلا هذا inverted centrally located حكينا usually between the azophasteal and suprapubic هذه بتكون everted طالعة على برا. من وين ممكن تشوفها؟ fluid إذا في fluid pushing it from the inside. Here it pushed downward due to a bulge here, hernia for example. Here a mass pushing it upward and so on. Scars like these should be also, if they are. So to appreciate or comment on these things, you should know the normal. Dilated veins, the cirrhosis we see. These are the striations, either Cushing's or pregnancy induced. Discoloration is the linea nigra, becomes black, or this is the ecchymosis discoloration in the abdomen. We see it when we use certain medication, for example, anticoagulants as prophylactic for the patients and so on. Sometimes they develop subcutaneous hematomas or bleeding, which will appear like this, or other sides, bleeding around the umbilicus will flank, and we see it with severe pancreatitis, when there is pancreatitis. And the abnormalities sometimes present to comment on. But to appreciate these abnormalities, always it's important to know the norm. Stoma, you know what's stoma? Okay, we connect part of the bowel, for example, to the abdominal wall for certain reason. Also, if it is present, we need to comment. Movement, as we said, comment on movement of the abdomen, and there is peristalsis evident. If it moves with respiration, they are reported. Cases of severe infection بالabdomen like peritonitis, there will be no movement of the abdomen. The normal breathing pattern is thoraco-abdominal. While if there is peritonitis, it will become solid. The abdomen will not move. Patient avoids moving the abdomen so not to induce pain. Aortic pulsation, sometimes it's seen transmitted, the thin or anxious patients. Normally it is not seen. But there are exceptions for seeing the aortic pulsation. If there is any evident bulge, especially in the inguinal region, non-common, or any other regions around the umbilicus or epigastric for hernias, especially if this bulge will increase when asking the patient to cough. هذا كلها بالإنسبكشن will be evident. We should comment on these things. حد له سؤال؟ This video he will proceed to palpation here. Later on we have auscultation. Usually we do auscultation, but then we proceed to another palpation of the abdomen. Palpation لا في general palpation في specific palpation. General palpation في superficial with deep. You palpate all the abdomen. Specific, you start looking for certain organ, palpate for certain organ.
Areas of the tummy. Can I just check before I do that you don't have any pain at all?
No, I don't.
This is the superficial palpation. The objectives of superficial palpation is connecting with the patient, gaining the trust of the patient is one thing. If there is any superficial masses or superficial tenderness, also it will be clear. Superficial, you will not dig deep. So deep, you will press harder.
James, I now need to press a little harder.
Okay, the simple palpation usually go over the 9 regions. You will have your own way, either clockwise, counterclockwise, or just region by region. 9 regions اللي حكيناهم. There is pressing harder, so to pick any deeper tenderness or deeper seated masses.
James, could you now take some deep breaths in and out for me?
Okay. Again, palpation الهدف منه ايش هو؟ لو نحكي general palpation to pick what if there is masses or tenderness, most important objective. The deep palpation, usually you will start to know this when you practice patients. You will start to appreciate tone of abdominal wall muscle. You start to know what's guarding or rigidity. وهذه أشياء very important findings بالcases of peritonitis, either localized or generalized. مين بعطي الإكزامبل وين ممكن يصير rigidity للأبدومين؟ طبعا rigidity it's involuntary, the patient cannot control it. Okay, yes, localized perforated, ruptured كل الأبدومين بصير generalized will be a board like which is involuntary. Patient cannot control it, even whatever you attempt to relax the patient, he will not. How do you start to appreciate the tone of the muscle when you do more deep palpation for normal patients and for patients with peritonitis? For organs or structures, liver, spleen, kidneys. Should know the technique to do liver palpation for the liver or hepatomegaly and spleen and kidneys. You start from the right iliac fossa, then you go upward, asking the patient to take deep breath. Well, simply liver will be pushed by taking the breath diaphragm. So if it is enlarged, it will come into contact with your hand, lateral aspect of your finger, the hand. You ascend by asking the patient to take a deep breath, and you will release your hand with the expiration. Normally liver is not palpable. اللاين اللي بنمشي فيه midclavicular line. up to 2 centimeters below costal margin, usually also within normal variations. They don't signify liver enlargement. ولكن liver examination from where to start? From where? When? Right, iliacus, yes. Okay. وعلى vertical line, midclavicular line. Ask the patient to take deep breath while we release our hand. For the spleen, where we start also for the spleen? Right iliacus. That's right, because of the axis of growth of the spleen. Also, if it is enlarged, it will go with it for this way mainly. So you start away to know if there is. Okay. For the spleen, you will start palpating the right iliacus or going to هاي المنطقة إيش بنسميها هاي الريجن؟ left hypochondrial area, left flank here. So we'll go up to this region to check if there is any splenomegaly or enlarged spleen. Normally the spleen is palpable. No, it's not palpable. Usually if you feel the spleen, remember it is enlarged at least 4 times its normal size, so to be palpable. We palpate to right to left hypochondrial area. Then we do to make sure it is not a borderline elevated. By press, بالنسبة للspleen, we press here, push here, and check if it is enlarged. And then now for the kidneys, we call it bimanual examination. We press على اللوب from the back and squeeze and ask the patient. So if kidneys enlarge, they will move between your hands.
James, I'm now going to tap on your tummy.
Okay, this general palpation, as we said, for organs, this is the direction where we palpate, and this is the technique described written. Better to do it. Here, see it right way, then do it. This is the way you learn the technique. ولا تقرأ 100 سنة ما راح تعرفوا إذا ما. Cases if you suspect there is liver enlargement. If you feel the liver edge, for example, 4 or 5 centimeters below costal margin, you want to confirm their enlargement, we do another technique, we call it liver span. We measure the distance of liver dullness. This is by percussion. So we percuss from second intercostal space. شو متوقع يكون بالpercussion note? You know what's percussion? ما بتعرف percussion ولا عمرك عملت percussion ولا؟ هسه راح تشوفوا. If it is gas, it will be tympanic in the lung until it become dull. شو يعني dull؟ صوتها. هذا بيكون الليفر. You will then complete until it is resonant again له الباول. But distance هذا بتكون dullness of the liver, بنسميها liver span. This from here it is resonant من الباول, from above it is resonant from the lung. In between is the dullness of the liver. You measure it يكون liver span بالسنتيمتر جوال 8 to 12 centimeters هذا normal liver span. For example إذا كانت 20 سنتي معناها في liver large. This is for the spleen. You start as we mentioned من right left fossa وليس من الليفت upward. ليش؟ لأنه حكينا if there is splenomegaly or enlarged spleen, the axis of its growth راح يكون with for right left fossa rather than descending down. Here it is by manual examination. We press على الrib cage from posterior, tilted to your side, so you will try to drop the spleen if it is borderline elevated, enlarged, so you can feel it at this examination. After tilting the patient and pressing by manual, by body. The kidneys, as we mentioned, pressing loins, right lumbar region, right loin and left loin, and pressing at the same time with your hand the abdomen. So asking the patient to take deep breath. If there is enlargement, it will be pushed between your hands while you are examining or pressing. This is for both sides, the right and the left. Part of the examination also the inguinal region, as we said, especially if there is suspicion of bulges. Okay. Other technique اللي حكينا بالpercussion. This is the percussion. This is the percussion technique. Is trying to assist for the lower edge of the liver by liver span. And this is the tympanic or tympanic node of percussion. صار change. This is the dullness for the lung. The distance اللي percussion note different, but you need to do it so you will appreciate the sound and the feeling. Well, liver span. So percussion, this is how you do it. This is the sound you should pick normally if there is no abnormality. We do general percussion all over the abdomen initially. Usually note is tympanic. If there is change, I feel something abnormal, either fluid or mass. Of the abnormalities, as we said, there is ascites or fluid. We need to do certain techniques to look if there is ascites. One of them is the shifting dullness, we call it. The transmitted.
If you could roll onto your right hand side for me, James.
This is the shifting dullness. You will percuss until it will change from tympanic to dull. Then ask the patient to tilt. ليش؟ لأنه fluid will shift down, so it will change again from dull to tympanic. Bowel sound. It will indicate the presence of ascites or a fluid. هذا إيش بنسميه shifting dullness. This is for ascites.
And roll back. And I'm just going to listen to your tummy.
Okay. So percussion, as we said, general percussion, usually is tympanic. For the organs, also we do percussion for each of the organs in the way we said. Is the shifting dullness, as we said, we percuss from the center peripherally until it becomes dull, percussion note. Ask the patient to shift to the other side. If it changes again to tympanic, so there was a fluid causing this dullness, confirmable ascites. How to do percussion? Usually you do general percussion with 4 quadrants of the abdomen. You check the note. For the liver, for the spleen, also you percuss. If for the presence of fluid, you need to do it. Even if there was no abdominal distension, you need to show how to do it. Shifting dullness, 2 techniques, shifted dullness with transmitted thread. You should learn both of them. Okay.
Does not have any abdominal distension.
This is a technique of doing either shifting dullness and transmitted
Tension, which means we would not typically attempt this maneuver on her in real life. So this is a little bit of an artificial demonstration, but this is what it would look like.
So that he started from percussing centrally, peripherally to peripheral. Percussion will change from tympanic to dull, if there is a fluid here. At this area, he will ask the patient to shift to the opposite side. If it is fluid راح ينزل لتحت طبعا. شو راح يجي مكانها؟ الباول راح يرجع percussion note tympanic again. This indicates the presence of ascites.
The last ascites maneuver is called the fluid wave, and it requires a second examiner. One examiner places
fluid wave or transmitted thrill, the name of the technique. If there is a fluid within the abdomen, you ask your colleague to put his hand here and you push with one hand here, and you will receive the wave by the palm of your hand to the other side. Okay. الهدف من الهاندز here انه pressing wave is not to be transmitted through the abdominal wall itself, so it will be falsely positive. راح تكون positive if there is a fluid only.
their 2 hands against the midline of the anterior abdominal wall, while the other places their hands on either side of the distended abdomen. While the first examiner's hands stay still, the second rapidly pushes against one side of the abdomen and observes for a wave of fluid to be felt by the other hand. The point of the first examiner is to prevent movement of the abdominal wall itself from confusing what's felt by the second examiner. Occasionally, if a second examiner is not available,
Okay. Now we back to auscultation.
بقول لحن خلص.
Auscultation, you will listen to the abdomen, usually with 4 quadrants for a certain period of time, 15 to 20 seconds. You will notice the sound of bowel. Also, you will listen for if there is any pulsations. Another objective of auscultation, bowel sounds, and if there is thrills or vascular thrills or bruise, and GI bowel for and the vessel. Usually we listen for 15 to 20 seconds. The normal bowel sounds 5 to 30 per minute. Anything in between this number, usually within normal range. You listen up to 15 to 20 seconds, you will multiply, for example, 4 times within 15 seconds, multiply it by 4 for عندك normal power sound. If it is absent, you listen for example, 1 full minute or 2 full minutes, it's absent, it indicates Elias. Usually to confirm if it is absent, listen for 3 minutes. If it is silent, there is no vowel sound, this is Elias. Elias يعني إنه it's not moving the vowel. كل ما زاد النمبر it will dictate certain hyperactive مثلا في intestinal obstruction trying to overcome this. For vascular, you listen for the aorta, renal, iliac, and femoral pulsations. These are the sides of the stethoscope to listen for. حد له سؤال؟ Is it confusing? يعني ولا examination unless you practice it always will be confusing, always will be stressful. It's very simple, very easy. مش شوي طلعت وراي ايه؟ والد بيعرفش عندك نوام؟ رد علي على مسج ورجع قبل شوي طلعت رايح جاي زي في واحد طلع قبل شوي مين اللي طلع قبل شوي؟ Okay. Another things to look for abdominal aortic pulsation you might examine for. abdominal aortic كده لما يكون في hopefully not yes بس ما يكون بالاكزامينيشن في evident pulsation حكينا دائما بالعاده ما بنشوفه الا باكسبشنز مثلا اذا كان thin patient, anxious patients, anemic, or كان في tumor above the transmitted pulsation فيها او كان في aortic aneurysm or dissection sometimes we see. That's why we need to examine this certain situation. Lymph nodes, either cervical, axillary, or inguinal, are part of abdominal examination, especially if there is abnormalities present. مثلا في mass بالabdomen, inguinal lymph nodes, important to examine. Costovertebral angle أو renal angle tenderness, especially إذا كان في symptoms of upper urinary tract infection, فيكون tenderness بالrenal angle or costovertebral angle. Inguinal scrotal, as indicated as mentioned, if there is bulge or swelling below lower abdomen, lower inguinal region, so it might extend to the scrotum, direct or indirect hernias to differentiate, or varicocele also. So inguinal scrotal examination technique another entity وأكيد المفروض later on we will be trained to do it. It's different. At this stage to pick there is abnormality in inguinal-scrotal region, and if there is abnormality, you will learn the technique to do inguinal-scrotal examination. Always offer to do inguinal-scrotal examination, حتى بالabdominal examination, and rectal examination, digital rectal examination, and proctoscopy. It will be very difficult for you to practice on patients to do PR or digital rectal examination, but always offer to do it, always. Okay. So basically another scheme examination, inspection, auscultation, percussion, palpation. Well, these are the objectives. This can the contour, skin movement, auscultation, we listen for this. Percussion, we general percussion, and for the liver, spleen, and other shifting dullness for the fluid. palpation as again, general palpation in liver, spleen, kidneys, and other parts, lymph nodes and so on. في certain things we need to learn how to do them, and زي ما حكينا they are associated with the abnormalities or pathologies the patient usually present with, either medical or surgical. Or we should know how to pick these Murphy sign, مثلا بنشوفهم cholecystitis, other signs McBurney, Robzinga, so we pick them with appendicitis and so on. Nervous sign for cholecystitis, for example. This is how we do it. We press our while we are pressing, we ask the patient to take deep breath. If the gallbladder cholecystitis issue, gallbladder inflammation, if it is inflamed, it will touch your hand, not directly, the peritoneum under your hand, so there will be pain. Patient will stop breathing. So it's cessation of breathing when taking deep breath while pressing the right upper quadrant. That is, you press by 2-3 fingers the right upper quadrant, you keep pressing, then ask the patient to take deep breath.
Okay, could you take a deep breath in for me?
If it is inflamed, the patient will stop breathing. It will be painful. Right.
Next, we have 3 tests that are.
These are also signs. You should know how to examine them if there is suspicion of appendicitis. Appendicitis is mainly when موجود الأبندكس بأي region. Okay, right. يكفي if you are describing according to regions, I'm right. Lower quadrant. Many signs. If you press this area, the McBurney point between the umbilicus and anterior superior iliac spine, 2/3 from the umbilicus, and McBurney point. If you press the tenderness, McBurney tenderness. If you press and remove your hand, هذا ايش اسمه؟ Rebound tenderness. If you press to the other side, left iliac fossa region, بصير pain بالرايت، هاي ايش اسمه؟ Robzing sign. And many other signs. Pteryter sign, Sawa sign. Here we show you some of the.
Going to help you assess whether or not a patient may have appendicitis. The first of those is referred to as Robsing sign. So what we're going to do to elicit Robsing sign is we're using kind of a dipping motion with our hands like this, and we're applying firm pressure in the lower left quadrant of our patient. Angel, do you feel any pain there?
He will sustain pressure. البين وين راح يصير؟ بالرايت. هذا اسمها Robsing. The most accurate direct tenderness بالMcBurney point.
So that's a negative Robsing sign test. In the case of a positive test, the patient would feel pain in their right lower quadrant. Tensing that fascia will cause an inflamed appendix to be rubbed up against by the fascia, and
McBurney point اللي هي بالumbilicus spine, anterior superior spine here, 1/3, 2/3. If you press here, this is direct tenderness, and it's a McBurney point tenderness.
because of the inflamed appendix, you may have actually some fascial irritation as well. So pressing down on that left side will recreate that pain. The second test that we're going to perform to test for appendicitis is referred to as psoas sign. So we are going to place our hand on the patient's right knee. And Angela, if you could just lift your leg against my resistance. Any pain or discomfort there? Okay, you can relax. So that's a negative sign again. For a positive sign, again, we'd be experiencing, a patient would be experiencing pain in that right lower quadrant, By flexing the leg, we're tensing the psoas muscle, and in the case of an inflamed appendix, that tension is going to further irritate the appendix and cause pain in the patient. The final test is going to require the patient to flip over onto their left side, and this is called the obturator sign. So I know I'm going to borrow your leg briefly here, just go ahead and relax. We're going to bring them into flexion at the hip, and then internal rotation of the thigh. You feel any pain or discomfort? Okay, again, that's a negative test. If we did get a positive test, the patient would again be feeling that pain and discomfort in the right lower quadrant. This time we're tensing the internal obturator muscle, and that's another muscle that lies close enough to the...
Other tests or examinations, with time you will learn to do them, to check for these patterns. Appendicitis, cholecystitis, because they are very common, very frequent presenting symptom, والسايز تبعهم موجودين بالمعظم الورds يعني موجودين all the time. As with time you will learn it's important to know how to do them. حد له أي سؤال؟